Hi, Dr. Cindy Likens with Direct Physical Therapy, coming on today to highlight a pretty common class of low back injuries, and those are what I tend to call flexion-based injuries. Flexion meaning a forward bending type movement. So for example, bending over to pick up a sock off the floor, or reaching kind of far out in front of you to pull weeds or pick up a box without actually bending your hips and knees. Most of us do that quite frequently throughout the day, and a lot of times you can be okay with it a time or two, but if that's a repetitive type movement, that tends to cause issues. Or if it's very forceful with a weight away from you, it's going to get you in trouble. So two common syndromes that I see with flexion-based injuries are a lumbosacral or lumbopelvic, I guess you could call it, sprain, strain. A sprain is basically an overstretch of a ligament, which is kind of like a gristly material that helps hold the vertebrae together. A strain would be an overstretch of the muscular tissue. So very similar pain pattern there. Basically, your back hurts, okay? And it's worse when you tend to bend forward or do the same type movement that got you there in the first place. The other classification of or other type of injury that falls into that classification of flexion-based injuries is it's an annular injury. So the annulus is basically the outer covering. It's a fibrocartilage neurovascular capsule that sort of covers the outer covering of the intervertebral disc. So it's kind of like a little bit of a shell. Similar to ligament material. It can heal because it has good blood supply, so that's a positive. But research has shown that those outcomes are much better if movement is initiated right away after the injury, and not, you go home and you lay in bed for 3 or 4 days after you injure your back. That's not good. Even though it might feel good at the time, I discourage you, if you've recently injured your back, just to go and lay down is probably the worst thing you can do. And especially if it's a disc injury. And the reason for that is because your disc is comprised of mostly water. It's kind of like a jelly-like substance. And when you lay down, it actually soaks in more fluid. So it might sound good to hydrate your disc, but the problem is when you stand up and gravity's a factor again, all that extra pressure inside the disc and then your vertebrae kind of coming down on each other is going to be super painful. And typically those people can't fully stand upright. They're stuck leaning forward, or they have to hang onto the counter or something. They walk their hands up their legs to try to go from sitting to stand, and that transition is really not fun. So both of those injuries, the spinal sprain strain, lumbopelvic sprain strain, or an annular discal injury, or you could call it a disc bulge because part of the material kind of comes out the back of the annulus. Those typically result in a loss of spinal curvature in the lumbar spine. So just a quick view from the side. You can see how this guy's a little stiff, but you should normally have a little bit of a lordosis, excuse me, which is kind of like a backward curvature of the spine, backward bending, and you have a little bit inside the neck too. So your thoracic spine kind of bends the other way. Those curvatures are basically, they're there for shock absorption and just to kind of help support your muscular system. So the problem is when we start to lose those curvatures and the spine becomes a little bit more straight, again, we don't have that shock absorption. There's a lot more strain on the muscles and ligaments around there, and your spine just generally feels heavy, stiff, just not real mobile. So it's not as resilient as it was prior to having that curvature. So, the number one goal with both of those injuries is to restore that lordosis, get that curvature back as soon as you injure. Don't go lay in bed. Don't, hang over in a slumped position over a ball or anything like that. Don't go lay in a hammock or a recliner, because that's just going to put you in that same, and again for the model, forward bent position, which is not good. So kind of getting on your belly will help even if you don't press up on your hands, just getting on your belly, you can see how that starts to put a little bit of curvature back in there. And that's critical. If you can tolerate that, that's great. If you can prop up on your hands even a little bit more into what we call prone press up, we'll get into that a little bit later, or even standing and hands in the small of your back, backward bending to, to tolerance. If you get to a stiff area where it's a little sore, don't push through that too much. Those are great. Now the difference is, a lumbar sprain, strain, that pain's going to be typically localized mostly to your back. Your back hurts, and it's worse when you bend forward. Pretty straightforward. You can do some taping, you can do some ice initially. Backward bending is good, gently, and just really, again, trying to avoid that flexion. So use your legs, stick your butt out a little bit when you're squatting to get something. A disc injury or an annular injury can be local, but a lot of times, it can tend to radiate down your leg. So we call this radiculopathy, or some people will call it sciatica. That's a whole other debate. Sciatica is typically starts in the buttock. It doesn't start in the back. But some of these patients might not have back pain with disc injuries. They might just have, my butt hurts, or I've got tingling in my leg when I bend forward, and I can't tie my shoe, can't get my leg up because it makes my foot go numb. Those are signs of a nerve root being pushed on through a disc protrusion through an annular tear or strain. So again, backward bending is usually helpful if you can get on that right away and it doesn't worsen the leg pain. I would encourage you to do it. If all you can tolerate is laying on your belly to get rid of the leg pain, do it. It's possible that you may have a vertebrae that's rotated out of place because of the injury, because some of these flexion injuries also occur with a torsional force, and the disc is not a great resistor of torsion. In those cases, it's recommended that, I may need to assess and see if you have a vertebrae rotated out of place that you might need a manual manipulation to correct. But again, both of these things, critical that you get your extension back. Prop up on your elbows if you're on your belly. If you can tolerate that, that's great. Slumped sitting postures, not good. Hammocks, recliners, not good. Again, the discs can heal because it does have that blood supply, but it's only with repeated initial movement right after the injury. So, if you wait a week, your outcomes are probably not going to be as good. They're going to take a little longer. So stay tuned. We're going to be going over some core stability videos that sort of highlight the muscular system to help keep your spine in neutral and prevent this problem in the future.